Today we begin Chapter 21, Incoming Substances, and the two systems that we're going to be discussing in this chapter are the respiratory system and the digestive system. The respiratory system consists of organs that transport oxygen and carbon dioxide to and from the blood, and that is composed of the nose, the pharynx, the trachea, the bronchi, the bronchial tubes, and the lungs. So there are a lot of different structures that make up this respiratory system. The oxygen in the lungs goes into the blood, which then is transferred to the body cells. And then the carbon dioxide is removed from the cells by the blood and is taken to the lungs where it's going to be expelled. Now, the nose itself refers to not only the part of your face that you see, the external nose, but it also refers to your nasal cavity. And the nasal cavity is divided into two parts, a right and a left side, by the nasal septum. And the nasal cavity and this septum, all together, are lined with membranes that help to warm and moisten the air. Now, you've probably been told that it's better to breathe through your nose than it is through your mouth, and the purpose is the nose then will warm the air and it'll also moisten the air so your lungs don't dry out. Now, when you're exercising strenuously, you can't breathe enough air fast enough through your nose, so you end up breathing through your mouth, but then your mouth gets dry. Okay, now the nasal cavity is lined with ciliated mucous membrane, and you can tell that the mucus is going to be formed there, and it has a special purpose, and its purpose is to filter out bacteria and smoke and dust particles out of the air. Then, in addition to the nasal cavity, you also have nasal sinuses. These are air-filled cavities that open either into the nasal cavity or into your throat, and they're also lined with ciliated mucous membranes. And so when you have sinusitis, this is when you have an infection of these air-filled cavities, and then that will drain down into your nose or into your throat. Now, air drawn through the nasal cavity is not only filtered, but it's also warmed and humidified before it reaches the remainder of the respiratory system. And so this prevents the delicate linings of these structures from becoming cold or dry when the air is not particularly warm or moist, like often in winter. And the upper portion of the nasal cavity has nerve endings that are involved in sensing odor. So your sense of smell is also in your nasal cavity. The nose has a palate, which serves as the floor for both the nose, and it serves as the roof of your mouth. And it has two main parts: the anterior hard palate, that's the part toward the front. When you stick your tongue up to what we call the roof of your mouth, you're feeling the hard palate, and it's dividing your mouth from the nasal cavity. And then if you push your tongue way toward the back, it gets softer. That's your posterior soft palate. And the posterior soft palate uh, ends in a structure that's called the uvula. The hard palate is actually made out of bone, and as you are growing in as an embryo, the hard palate is supposed to grow together, and you can kind of feel a little ridge in the top of your mouth with your tongue where the two bones have grown together. But in some babies, that is not doesn't close up completely during while they're developing inside the womb, and this produces a cleft palate. You probably heard that term. So there's an opening between the nose and the mouth, and often it has to be closed up through surgery. Now back to the soft palate. The end of it is that little thing that hangs down in the back of your mouth called the uvula, and when you swallow, the uvula moves back and up to prevent food from being pushed up into your nasal cavity. So it's just an extension of the soft palate. Now in this diagram you can see the sinuses. You have some of them that are located like over your eyes, and then some underneath your eyes. They all are connected either to the nasal cavity or to your throat. Then you also have where the hard palate is located, and it is made up of the bony portion up in the front that extends forward, and your teeth are attached to that. And then you have the soft palate that is in the back. And then that little piece that hangs down in the back is called your uvula. The pharynx, commonly called your throat, is just a muscular tube, also lined with ciliated mucous membranes. The idea behind the cilia is that when mucus is produced, the cilia can move it away from the area that it maybe have too much of, like down to the throat or something like that. And this pharynx, your throat, this muscular tube extends from the back of your nasal cavity down to your esophagus, and it serves as part of both your respiratory system and your digestive system. So in other words, food and air both will go through your pharynx. Now the pharynx has a bunch of different openings. It has about 7 of them actually, and these openings are, you have like 2 of them from the back of your nasal cavity for air to flow through down to your lungs. You also have 2 passageways that go from your throat to the backside of your eardrums, called the eustachian tubes, and their job is to equalize the air pressure. So if you have your ears need popping, you say, and you swallow, then these tubes will open up and equalize the pressure. So the pressure on both sides of your eardrum will be the same. Then you also have the opening to the mouth for food and air, obviously. And then you have the entrance to the esophagus, where food will go down to your stomach. And then you have the entrance to the larynx that's going to carry air eventually to the lungs. So you have 7 different openings that are all connected to your pharynx. Now the larynx is your voice box. It's just a short little passage that leads to the pharynx, or from the pharynx to the trachea. And you can see in this diagram here that the larynx is located right here, and below it here is the trachea, and then the pharynx would be above this. Over here is where the pharynx would be. The walls of the larynx consist of several cartilage structures held together by muscles and ligaments, and the larynx contains a pair of mucous membranes, or known as the vocal cords. And if you look in this diagram over here, you can see the vocal cords are located kind of like in this area right in here. The walls of the larynx, as I said, consist of several cartilage structures that are held together, and so there is cartilage. You can see here where it talks about the thyroid cartilage, and then you have different names here for different kinds of cartilages for the detail of all of that, but it's made out of cartilage. So it's not made out of bone, it's actually made out of cartilage. And you produce sound as you allow air to be expelled from your lungs over these vocal cords, and it causes them to vibrate. If you remember from physical science that everything that vibrates can produce a sound, or for every sound there is a vibration. Now the vocal cords, as you can see right here, the vocal cords are those two strips that look kind of whitish colored, and when you're trying to make sound, this area right in here is pulled pretty tight, and as you push air between them, it causes them to vibrate and make sound. When you want to breathe, they are relaxed and they go off to the sides, as you can see over here. And that's why you don't make any noise when you're breathing. If you're making noise, it's from other things that are going on inside your body. Now the space between the vocal cords is called the glottis. So right here is pointing to that line in me, the little gap that's in between there is called the glottis. And when you swallow, there's a flap of tissue called the epiglottis, and that's right here. The epiglottis, in both pictures over here, has it, and that will fold over your larynx to keep food from going down the wrong pipe, we sometimes say, and getting down into your lungs. Because if some of it gets past there, then that's what makes you want to have this coughing spell to get rid of all of that. So you have the glottis. That's the gap between the vocal cords. And then the epiglottis is the covering that's pulled back most of the time when you're speaking or inhaling. But if you want to swallow, that's got to close up that gap so that food will go down your esophagus and not down into your lungs. The trachea is a tube from the larynx, and it goes down toward your lungs to what we call the bronchi. And the trachea has some C-shaped cartilage rings, and the C is positioned so that the open end of the C is toward the back. because your esophagus is in that is right behind this open area of the cartilage. And if you've ever swallowed something a little bit too big, it makes you feel like you are going to have difficulty in breathing. It's because the esophagus is able to push into the open end of that trachea, making that air passage smaller. Now, if you were to swallow something that would block that entirely, then somebody might have to do the Heimlich maneuver on you to get you to cough out that thing that's blocking the air passage down to your lungs. So your esophagus runs right behind these rings, and because of the way these cartilage rings are, there's some muscles and tissue that is between these cartilage rings, allows it to be flexible, so you can move your head in all directions without injuring your trachea, because it's really flexible. And your trachea also has ciliated mucous membranes in it, and it helps to trap foreign particles like dust and pollen. And when your trachea is irritated, it'll produce more mucus, and the cilia will try to move this mucus with the foreign substances up to the pharynx where you can swallow it. And then once it's swallowed it goes down to the stomach, and if there's anything harmful in it, the stomach acid will just destroy it. So here's a diagram. So the top part, there's their larynx. That's where we call their voice box. And then we have the trachea is that tube that runs in between here. We're looking at this trachea from the front. Those C-shaped are open to the back side of the picture. And then the trachea divides into two tubes that one goes to one lung, one goes to the other lung, and they're called the bronchi. Now, as we said, the bronchi are just two branches of the trachea that lead to the lungs. And when you have bronchitis, you have an inflammation of those bronchi. They become inflamed, they produce more mucus, and it can be kind of painful, maybe even interferes with your ability to breathe. Now, once you get into the lungs, the lungs are going to be the place where gas is exchanged between the external environment and the blood, and the lung is divided into 5 lobes. Your right lung has 3 lobes, and your left lung has 2 lobes. And the reason why your left lung has 2 lobes and your right has 3 is because your heart, which is positioned kind of like in between the 2 lungs, your right lung and left lung, is actually more on the left side, and it's picking up some of the space of the lung. So your left lung is just a bit smaller than your right lung. Now, each lobe of the lung receives a separate branch of the bronchus. Bronchus is singular, bronchi is plural. And then each bronchus divides up into bronchial tubes. And these will then, so here's your trachea. There's the left bronchus. Remember, this person is facing us, so that's on his left side. Those are the bronchial tubes. And then the bronchial tubes are broken into bronchioles. So each part is getting divided smaller and smaller and smaller. And then at the end of the bronchioles is what we call the alveolus. Okay, so there's the bronchioles, and they are divided up even smaller into these little microscopic bubble-like sacs called the alveoli. And they kind of look like grapes. And the outside of this, of each of alveolus is covered by a small or a very extensive network of small blood vessels called capillaries. And you can see the red capillaries and blue capillaries. The red capillaries means that it's trying to show you that's the part that's carrying oxygenated blood, and the blue side, which is not really blue, but is the blood that has been deoxygenated. It has less oxygen on that side. And you have a lot of these alveoli in your lung. It says in your book that most lung tissue is composed of about 3 million of these. So you have a lot of these tiny little ones in your lungs. Now, the close relationship, physical relationship of the alveoli and the blood capillaries provides rapid exchange of carbon dioxide out of the blood and into the lungs, or oxygen from the lungs and into the blood. So they're bubble-like sacs. They're surrounded by lots of capillaries. Now, you may have heard of some people who have emphysema, and emphysema is just a long-term progressive disease of the lungs, and it causes shortness of breath. And the reason why is it's due to an overinflation of the alveolus. So you can see the numbers that they're talking about right over here is this is the pressure inside your lungs, and this is the pressure here. And remember that air always moves from high pressure to low pressure. So it will move in to the alveoli sacs where the oxygen can get into the bloodstream, the capillaries. Now, one more thing yet about the lungs is that the outside of the lungs has a very delicate membrane called the pleura, and it lines both the inside of your chest cavity, your thoracic cavity, and there's also one that lines the outside of your lungs. So there's actually like two layers, and in between these two layers, we call it the pleural space, and the pleural space is filled with a fluid, a pleural fluid we call it, and it lubricates these two membranes so that they don't rub on each other as you inhale and exhale, which would make it very painful when you're breathing. And so if something happens to inflame those membranes, the pleura, you can experience something called pleurisy. It's very painful as you inhale and exhale, but it's because these membranes have become inflamed for some reason due to maybe an infection or something like that. So in between these two layers is called a pleural space, and it's filled with a pleural fluid. And then we talked about pleurisy is if you have an inflammation of that. Now, asthma is another disorder of the respiratory system, and it's a chronic breathing disorder. And what it does is it causes your bronchioles to become constricted. That means to become smaller, like it does over on the right side. And often people who have trouble with asthma will have an inhaler. They'll usually take a couple puffs of their inhaler, and it will cause the walls of the bronchioles to dilate. That means shrink, I mean, to get bigger around to allow more air to pass through on their way to the alveolus. So it would become more like the one on the left after they've taken their inhaler. And then pneumonia is another disorder of the respiratory system. And pneumonia is just an inflammation of the lung. It's usually caused by an infection. And there is different kinds of pneumonia. There's viral pneumonia and bacterial pneumonia. And it causes the bronchioles to become inflamed, as well as mucus to fill up these alveoli. And you can see that's going to make it very difficult to breathe. And if that's not stopped, or if the body doesn't, get a handle on the infection, you could see it could ultimately lead to asphyxiation, and the person could die from that. So you can see that in the bottom picture, the alveolus is filling with mucus, and the bronchiole is inflamed. And so an inhaler causes it to dilate, which means to get bigger around like it is in the top picture. Okay, so that takes us through the anatomy of the respiratory system. Tomorrow we'll actually talk about respiration. How does the body take oxygen in and out? In other words, how does it function?